Hi, I'm Dr. Julie Steinauer. Let's talk about torticollis and its effects or problems that it can cause with vision. So before we jump into that topic, I want to tell you how you can connect with me. If you're local, call us at 618-288-1489. If you're not local, go to our website at visionforlifeworks.com where you can fill out a questionnaire, or you can click on the schedule a consultation button and schedule a consultation with me. Okay, so now let's talk about torticollis and why I'm bringing that up today to talk about vision. So torticollis is a condition in which there's a head tilt or twist. It's really common or fairly common to see in infants. And so if you notice that they tend to be twisted or tilted into a particular position and they look kind of curved and maybe they twist up to one side, that would be an indicator that they have torticollis. Chiropractic care is definitely needed in order to help get alignment of the cervical spine, and if there's any kind of malformations or misalignments elsewhere within the spine as a result of it, you want to get those things rectified. It's a reason why some kids will be really fussy, may cry and scream and just, fuss with eating, fuss with sleeping, just kind of unhappy babies. And they usually can have a lot of things going on. But the reason why you want to get it addressed right away, like immediately, is that if they have this type of a twisted, contorted problem and it is because of cervical vertebrae being out of alignment, then the issue is they could have an impeded blood flow that goes to their brain and throughout the rest of their body. So they can actually develop motor weaknesses on one side of their body. They can develop eyesight problems and vision problems. In fact, most babies that have torticollis, probably can just say all 100%, but they will develop strabismus or an eye turn, and some of them will develop amblyopia where the eye doesn't see as well. This is absolutely due to the fact that there's like a blood flow being impeded from the neck area going up into the skull and head, and which will affect the blood flow to the nerve of the eye, which will affect the ability for the eye to process visual information. So it's really important, and again, this is not just about vision, it's also about the rest of the body. They can develop motor weaknesses on one side if blood flow is impeded or impinged going, up into the brain or down into the body. And it can affect lots of things like cognitive ability. So sometimes these kids can seem to be delayed. They might be motor delayed because they don't want to crawl or move around or anything like that would typically be seen as normal for an infant. They might be a little bit less active. And this is primarily because there's a misalignment. If that misalignment is significant enough, again, what it's doing is it's impeding blood flow. And it can kind of cause some problems in terms of motor development and like muscular control and development. So you definitely don't want to ignore torticollis in your infant if you see that. So for more information about our clinic and how we can help, you can go to our website at visionforlifeworks.com. You can call us if you're local at 618-288-1489. But we're on the end of working through helping the person, whether that be however old they are, with their strabismus, helping them with their eye alignment, gaining the ability to use the two eyes better together as a team if they're amblyopic where one eye doesn't see well. Our job is to help ensure that the brain learns how to process better with that eye to see more clearly. The other thing I would say is that if you found this video helpful, pass it on to someone else. If you happen to know someone that has an infant that has torticollis, by all means, speak up. Don't stay silent. It doesn't mean, some people are concerned about saying something to the mom of an infant and offending them. Well, if mom wants to be offended, let mom be offended, because you really want to make sure that you step up and kind of speak out and let them know what, there could be some problems that goes on if you continue to let this, just exist with your infant. And they really want to get a jump on it and get it addressed as soon as possible, because the development of their infant really rests in how quickly they get it corrected. So you don't want to just let it go. So don't hesitate to speak up. It's really important to pass this information on. If you haven't done so already, hit that like and subscribe button, and also make sure you hit the bell icon for subscribing to all of our videos so you don't miss any cool information that we talk about. Thank you.